Welcome back to Let's Talk About It, All the Things. Hi, Whitney.
Hi, Chris.
How are you today?
Oh, I'm miserable. My power's still at the house.
I know.
That storm.
Yeah.
That was
a lot. That was some torrential rain and a lot of wind.
I didn't get much rain over by my house, but the wind. That is what got me.
Yeah. Well, hopefully you're going to get your power back today.
I hope so.
That would be amazing.
I've been debating on pulling my generator out. I'm like, I don't want to waste the gas.
Well, today we are super excited to have guests.
Yep.
I know, 2 in a row. So you guys don't have to listen to us talk.
I think that's a record.
It is. You guys should be really grateful. So today we're really excited. We have Lieutenant Michelle Hesse from Auburn Hills Police Department, and we have Kourtney Thomason, I got it right, from Oakland Community Health Network. And I'm really excited about this. I have known Michelle for, I don't know, it seems like a gazillion years. We CrossFitted together. She still does. I backed down a little bit.
I get back into that.
I'm a little soft. I know.
I saw that you did the cardio drumming, though. That's
I did. Yeah. So I'm still doing fitnessy type things, just not CrossFit. My body at 52 has decided that perhaps that's not the best.
52. I never would have guessed you were 52.
Oh my God. She's my new favorite, everybody.
It must be CrossFit saving you.
So anyways, I have known Michelle for quite a while, and she's always been a huge mental health advocate and a supporter, and she's an amazing person, and I'm just so grateful to her for all that she does. And she, I believe, I'm going to have her talk about it, but kind of helped jumpstart the mental health ride-along program with Auburn Hills Police Department. So I want her and Kourtney to talk about that. So welcome, Michelle and Kourtney.
Thanks for having us.
Yes, thank you. I'm glad to be here.
Absolutely. So Michelle, tell us a little bit about how that even started, or how did you get that going in Auburn Hills?
So the caveat to all this is that I wasn't part of the brainchild. This was kind of the idea of actually the police chief at Birmingham at the time, Chief Clements, who is now retired, but he does still work for Birmingham in city administration, so that's good for everybody. But he had this idea, and he got together with some of the other police chiefs in the area and said, we need to do better. We need to do more. We can do better with response to mental health type incidents. We've all seen the bad stories in the news with things that have gone bad. And what can we do better? We can do better. There's public, demand for it, as there should be. And they came up with this idea of partnering with Oakland Community Health Network, or OCHN as we'll refer to them, to provide this service, which is basically having a co-responder, as we call them, a social worker, available to us to not only respond to calls with us, but also to respond to follow up with certain incidents about if families need resources. Before, there was really no conduit for that. It was like we went to this house, maybe we talked to this family because we were called there because they were having trouble with their teenager or what have you, and we would try to talk them through it. We do have some training with regard to that, but not as nearly as much as what they have, and not nearly as much as training as what they have, or expertise. So now, if we go, and even if they're not available, or even if they're not there with us, they can always follow up with these families in order to connect them with these resources that we didn't even know existed when this program started. So that's kind of an overview of how it started, kind of how it goes.
Wow. That's amazing.
That's so cool. So what does it look like on a ride along? What does that
So they actually they come in their own car.
You do?
They do.
Okay.
So you call them up and say, hey, we need you out here to this location?
Yeah.
And then you go?
So, there's quite a few of us now throughout the county, and we do it all a little bit different. In Auburn Hills and the other 3 communities that I work for with my partner, we do respond in our own cars, but there is sometimes, like if it's a slower day, we do hop in the car with officers, and if there happens to be a call, cool, we're already a team here, and we go and kind of handle the situations. But we're connected to we have a police radio, so we constantly hear what's going on. So if we hear some of those like keywords like welfare check, or when people are like people aren't acting the same, things like that, we can actually call out and add ourselves to the call. So we just tell the radio we're heading there, and that lets the officers know we're coming. And then we get this text with the link that has all the information that the officers can see on their computer, so we're just as informed showing up to the call as they are. Or if we're not on the radio and the officers are unsure if we're working or not, yeah, they call us on the phone all the time and say, hey, even if it's just like a quick consult, like this is what I'm looking at right here. If you can make it out, cool. If not, what should I do with this? So there's multiple ways that we get out there for sure.
How many people do you have on your staff that go to these calls?
So we're split off into different communities. So again, I work in 4 different communities: Bloomfield Township, Birmingham, Auburn Hills, and the city of Rochester. So there's 2 of us that service those. We have 1 team member in Pontiac, 1 team member in Troy, and now we have 2 with Hazel Park, Royal Oak, Madison Heights, and Ferndale. So that's what we're at right now, and we're hoping to expand to more communities soon.
Wow. I didn't know it was so like out there in so many communities that you guys had this. I knew Auburn Hills, of course, from Michelle. And I think Waterford is also.
Waterford's
Already.
Yeah. So, I knew about just a few. I knew Royal Oak and some of those, but wow, you guys are in a lot more communities than I actually thought.
Yeah, it's kind of all props to my work partner Hillary. She was the first one, and at first it was just the 3 communities: Birmingham, Bloomfield Township, and Auburn Hills. And she just kind of put her foot in the door and made this happen and grew the program, and that's why the rest of us exist. So once they realized this works, everybody was just like, we want a co-responder, and it's just exploding.
That's amazing.
What is the difference that you've seen on your calls prior to bringing your company in to help with this as of now?
Mm-hmm. There's been a lot of differences, and I don't think we've even recognized some of them. We've been at this since about 2021-ish, and it's still evolving. We're still learning. We're still trying to work out some of the kinks that happen. But there's a lot of differences, and we actually have a research partner. Wayne State University came in, and they said that they wanted to research the program. They researched different co-response type programs throughout the state. So there's ours, and I think there are 4 or 5 others that they've looked at. And with ours, they have seen some differences. They took a data from about a year to a year and a half it was, and they saw reductions in uses of force on calls, which is not an apples to apples comparison, because if there's a violent scene, we don't take them in with us. So it's not necessarily apples to apples comparison, but it's something. And we also saw a reduction in involuntary hospitalizations, and more of them are voluntary now, because we do find that when we do have them to take with us, we're able to reason with somebody more about and better explain about what's going to happen, what's it going to look like when you get to this place, what's going to happen from there, what are the resources that you might have available to you, rather than we only have a very narrow view of what happens when you first walk through the door, whereas they can explain more and clarify with the person what's going to actually happen.
That's amazing. Yeah. So, from your perspective, what do you think? Like, what's the impact? Like, what's the difference that you think is occurring?
I think definitely more people are getting the resources they need. Like Michelle was saying, when police go out to these calls and somebody might be having a mental health crisis, it's let's go to the hospital and get you some help. But there's so much more to than just the hospital to get individuals help. And sometimes the hospital is not the best route, even though they do have great resources and it's a good first step to getting that help. But sometimes people don't need the hospital. Sometimes people really just need somebody to vent to, and then get connected to outpatient services or things like that. Or I I feel like there's probably been an increase in use of our crisis center. The Resource and Crisis Center in Pontiac. Common Ground is the adult crisis center, and then we have the Youth and Family Care Connection with the youth crisis. So I feel like we've seen a big increase of getting people into the hands of people that can directly help them. So it's not sitting in the ER and then you're moving to another floor and then you're doing this and talking to all these other people just to get the help you need. We kind of have been able to like shortcut the system to get people in faster so that way crises can be limited. So I definitely think with our program, we've seen that happen way more frequently.
I love that because, I mean, just from my perspective, so I get calls from frantic parents who are like, oh, my 14-year-old daughter says she wants to kill herself. What should I do? Well, from our perspective, it's you have to take them first to the emergency room. So you can call 988, but ultimately they're probably going to tell you to go to the emergency room.
Right.
And then the horror stories that we hear back is they're sitting there for, a week,
Yeah.
and they can't let them go. And so there's just, so I know that that's a huge frustration for families too, just, okay, so my child needs help, but I don't know what
also,
to do.
and we've talked about this, I think more specifically for kids or teens, they're afraid of that exact thing. They don't want to go to a hospital. They're afraid of that, we'll say judgment in a sense. They're afraid they're going to get pills, thrown down their throat. And so, yeah, I think that's a big reason why they don't want to say something. Much like you said, they just want somebody to vent to.
Mm-hmm.
So,
Absolutely. And that's why we encourage, whether they're adults or youths, we always encourage people to utilize Common Ground, because Common Ground, it's not perfect. They have limited capacity, and if they're full, then they do have to send folks to the hospital. But if you're experiencing a crisis in yourself, you're not sitting there waiting for somebody who's being treated for a broken arm
Right.
in order to get treatment yourself, where Common Ground is just the mental health. So we always encourage folks to use that because they know of so many other resources than just the hospital does. So we always encourage folks to go there. Unfortunately, sometimes they are full. That does happen. We need more space, and hopefully that's coming in the future. But Common Ground is an awesome resource.
And we know that that's a problem that our crisis center can only handle so much, because we don't want them to take everybody in and then be able to give them subpar service. Like, we want them to take what they can take and make sure people are getting what they need, and we'll shuffle through as we need to. But that is a barrier that we, like, through this program have noticed, like, sometimes our crisis center is overwhelmed and we do have to go to the hospital. So what can we do to make that hospital, not the hospital stay, or just like that immediate interaction in the ER a little bit better? So we've teamed up with, because OCHN, we're everywhere. We're literally everywhere. So we have liaisons that take care of everything hospital. So it's really as simple as sending an email to our hospital liaison and say, hey, we dropped off so-and-so to this hospital at this time, and we really think they would benefit from either an OCHN screening or anything like that, to make sure that they get what they need when they leave the hospital. So we do have people in the hospital to help make that process a little bit easier if we can't get them to the crisis center.
Well, thank you.
yeah.
Because we always hear the horror side, right?
course.
The really bad side of experiences. So it's nice to know that there's actually some help and some intervention on that side for them. And I mean, Common Ground's not the only one in the United States of America that's having problems. I
Right.
mean, it's across our country, just there's not enough resources and facilities to help the people that need it. So.
Right.
True.
And it's not all sunshine and roses. We tell, sometimes people unfortunately have a bad experience and we're like, please don't give up on us. So we messed up the first one. Please give us another chance. We'll get you to a different resource that maybe does work for you. Because it is a journey. If you've ever been to a therapist, you've probably been to more than one, because you go to one and you're like, not loving this person. And then you go to another one and maybe you find one that you like, and maybe it takes a few, but like, please don't give up. You know, so there's different resources out there, and they're all different, and they all serve different needs, and they all have different personalities and different things at play. But there's a lot out there, and we're fortunate to be in Oakland County because we were talking on the way over here. There's a lot of resources out there that a lot of folks don't know about, and that's why it's good for us to be here. Like you guys said before, like we didn't even know this program was so widespread into different communities. And that's why it's good for us to be here to talk about it so that folks do know. Because otherwise, unfortunately, they don't often know until they need it.
Yeah.
So,
Yeah. Yeah. Very true.
Do you see more, and I'm sure this will probably go into that study that I think you said Wayne State, was it, is going to possibly do you see more on the kid-teen end or adult end when you deal with those calls?
interestingly, the age group that was the more common age group was younger age. I think it was like 18 to 25 was the age. And I, you know, we can go talk all day about why that might be. I think there's a lot of reasons why that probably is. But that was the most common age group that we service.
Do you see a common variable as to why? Like more like, I just don't know what to do with life, or
I feel like we're just evolving into a world that it's more okay to reach out for help. And unfortunately, with just like COVID and other things that have been happening, like obviously worldwide, but also here just in Oakland County, I think trauma is a lot more prevalent, or like anxiety, depression, those things are a lot more noticeable. And I feel like our younger generations may be more apt to call for help or know when things aren't okay and reach out for those kind of things. So I think it's pretty common amongst all of our age groups. I just think maybe they're more likely to reach out for the help. There's no actual backing to that. That's more of like a clinical opinion of mine, but I just think it's okay to ask for help. It's more okay to ask for help now than it was before. So,
Well, thank goodness.
Good point.
That is huge.
Yeah.
Huge that I feel like that makes me feel good. Like we're actually making a little bit of progress, that people are actually okay with asking for help because it's just been so stigmatized for so long. So that makes me feel a little bit better, at least.
And isn't September mental health
Suicide prevention.
suicide? Yeah, because township just talked about it. So
Yeah. Yeah.
So good time to talk about this.
Yeah, it is for sure. So when going back to, so like, you know, you're on a call, you go out, and then you send somebody, let's say, to Common Ground. So Michelle had stated that there's some follow-up. So what does that look like? So are you following up with that person directly or their family? Like what does that, and how long, I guess, does that follow-up go?
So it kind of depends on what the situation is, whether I'm a social worker, so HIPAA is a big thing. So depending on the situation, I can only reach out to that direct person, which sometimes is the best and sometimes isn't the best option. But most of the time it is directly to the person that we're serving. So if we're on scene, we usually can provide that resource in person. And if there is something on top of that, like if I need to email them a link to a resource, or if I need to put in a referral to somebody in OCHN on one of our multiple teams that could be better fit to help them, that stuff can happen pretty immediately. But if there's something that needs to be done afterward, we typically try to make sure that happens within a week. All of our follow-up needs to be done within a week. That's just our policy, and like because we want people to get services as quickly as they can. I'd say the follow-up more so comes in when we're not able to be on scene. So if we're not on scene, we have this thing called a CORE form, which CORE is just short for our co-responder program, that officers fill out, and it's got all the information about the individual, an emergency contact, and just basically what happened on the scene. And then that's when we pick up the phone and try to connect with them and get them what they need. If it's something of like a higher severity and we're not getting them on the phone, we will go out to the house and try to connect with them, because we don't want anybody left behind just because, they might not be ready to answer the phone to get some help, but maybe if we knock on that door, and show up and say we want to help you, then it can sometimes make a difference. But that's kind of what the follow-up looks like.
And sometimes it is ongoing over a long period of time. I know they've had people that they've referred to other resources or maybe a therapist or an outpatient program or what have you. And they go to it, it's going great, and then something comes up later or something comes up with somebody that they know or a family member of theirs, and they end up contacting them again because this is who they know. And they know that they have all these doors open to them that they could possibly take them to.
Yeah, I tell everybody when I call, whether it's in person and I leave my business card or if it's on the phone, I'm always like, please save my number. You can put Kourtney social worker something, because if you need help, I want you to know there's somebody that you can call. So even if they're not ready for a resource at the moment, I still just be like, please just keep my number, because just because you're not ready now doesn't mean you might not be ready a week, a year, 2 years from now. So I always try to just be like, just keep our number, and you know how to get a hold of us if you need us, kind of a thing.
Yeah. That's amazing.
So I want to give you a scenario, and this is actually based off something that did happen, just so we can get a real good vibe of how you guys would respond to it. A 15-year-old, suicidal thoughts, goes to a bridge, staying on that bridge in the middle of the night, and that 15-year-old actually calls the cops and says, this is where I'm at, this is what I want to do. What would you do in that situation?
So we would respond out there and, of course, talk to them is the first thing. It wouldn't be something where we would just go out there and grab onto them and not give them any choices about the situation. We always try to talk to someone about the root causes of what's happening so that we can possibly get to the right solution for them. From there, of course, we would try to get, if they're 15, we would try to get a hold of a parent, a guardian, a family member. If the problem, maybe they're struggling with, they live with their parents and they're struggling with that relationship. So it would be better for us to call an aunt and then call the parents to let them know we're calling aunt or, what have you. And then if hopefully they would be on shift. If they're on shift, they would, of course, respond to that. If they're not on shift, we can still get them either to a hospital or to the youth center at Common Ground. So that's kind of an overview of what it would look like. And then from there, we would definitely be doing follow-up with the family to make sure that they get the resources they need. And I'm sure you have things to add to that as well.
Yeah, I mean, kind of just like, we just try to connect in some way. There's always usually, if you can get them talking, there's usually 1 or 2 key points that you can latch on to that really hit home with them, and then you can actually try to build that rapport to get them to make that choice to come down. I mean, obviously safety is key with ourselves as well as the person or the child having a crisis, but we really do try to just make that connection, because if you don't make that connection, you're not going to get anywhere. So that's really how we start it. As long as we can keep them safe, as long as they're not leaning over the edge, we're going to try and talk them down to get them to come down themselves, versus I can't even think of hardly any time of us actually having to put hands on anybody. We're usually pretty good at being able to get them to decide, okay, I'm ready to go get help, and they come down. So
the second part of our program when we started this was that we were committed to training all of our officers in crisis intervention training, or CIT. And that's a slow process because we have a lot of officers, but we're working on that, and that's helped as well with communication skills, especially with kids. Sometimes with kids, it's really hard to connect. And sometimes it takes more time it takes a lot of patience, because by the time we get involved, they've experienced so much, or the situation has deteriorated to a point where, they're really in a bad place. So part of that process of training all of our officers in CIT is that communication piece of talking and finding those hooks, whatever that may be, or finding the root cause of the problem and not just putting a Band-Aid on it for tonight, so that we can actually help this family and not just be going out there every single day to just put a Band-Aid on the problem for the day.
I love that. I keep saying that.
I know, right? Well,
I can't help myself. I love every little bit of this.
Yeah.
So it's CIT training. So is that just something that Auburn Hills has taken on, or do all of the police departments who are kind of utilizing this mental health kind of
Program.
program? Thank you. Do they also utilize it, or is it a requirement, or is it just?
We have tons of different police departments that come. Our sheriff's department is super dedicated in getting all of their deputies trained in CIT, but we have everybody, White Lake, I can't even, Novi, all sorts of, even if they don't have a corresponder, they're sending people to this training because just so they can be better prepared. We're not they don't go into that class hoping they come out as clinicians or that they're going to be able to, like, need to be able to diagnose this and that, but it's just like, the more people that are aware of mental health or the signs of substance use or maybe being able to pick up on somebody having like a intellectual disability just helps them better interact with people. So that's kind of the whole point of it. And that's, I think everybody in the county or a lot of our police departments can at least buy into that we can at least learn a little bit more about the people we serve. So I think that's a huge thing that everybody does. Definitely bite that hook for sure.
It's an extensive training. It's 40 hours.
Wow.
And it's learning really detailed information about a lot of the different types of mental illness that we see and the crisis that we see, not just mental illness. And then actually going through communication strategies and de-escalation strategies, and then their scenario-based training at the end of that week. And then we have folks come in with lived experience that talk about their experiences, positive and negative, what they've gone through. And sometimes it's just their journey through the mental health system. Sometimes it's talking about their experience with law enforcement, good or bad. But I think that's one of the more valuable parts of the training is having the folks with lived experience come in and talk to the officers about, and it takes guts for them. Standing up in front of a room full of cops and telling people about how terrible their experience was. So it's pretty awesome. And usually the room is extremely quiet and everybody is just laser focused, which is awesome to see. But there's a lot of personal stories that have come out of that too that we didn't expect to hear from our students, from our officers, that then start to open up and share their personal experiences with crisis or with mental illness, whether they've had it themselves or whether it's touched them with a family member or with a close friend. Because let's face it, who anywhere can say that they haven't been touched by either mental illness or crisis in some way? Really, to be real.
Everyone.
And not everybody has to share, but it does create an environment in that class, and it's pretty awesome to see where people share their experiences. Very personal.
I've definitely, even because I've been doing this for a little over a year, and I've seen officers that I've worked with them before they went through the class and then after they go through the class, and there's noticeable differences. Like, there's specific officers popping up in my brain that I know that maybe before the class, they still would handle the situation in a good way, but after these tools that they have on their belt that are new, I'm like, wow, I'm the clinician and I couldn't even have done any better than that. So it's like, even working with them, I see the difference between before and after, which is really exciting.
Mm-hmm. And I think it helps knock down some of the challenges that we've had when we started the program, because when we started the program and we brought them in, some of our officers weren't super crazy about the idea. It's like, who are these social workers? Are they going to take our jobs? And they're another person I'm going to have to try to keep safe on these scenes. Like, I just don't want to have another thing, And they have since learned, for the most part, some of them are still sticks in the mud, but they have since learned that this is an awesome program. They're there to help. They're there to solve problems that we didn't have resolutions to before. And I think going through the CIT training, they realize the doors that they can actually open. Because a lot of times we refer folks to them and we don't necessarily hear, because of HIPAA and because of privacy, we don't necessarily hear that, the person, enrolled in inpatient treatment, or the person went here or went there, or they're now on medications or whatever it is. That's information that they can't necessarily share with us. So sometimes it's like, well, I referred them to them and I didn't hear anything. What happened? Did they even do anything? And I think now with the training, they realize that, yes, there is this program a wealth of programs that they probably went to. Mm-hmm. So I think it's very helpful.
Have you ever seen somebody that you have been on scene with that maybe a couple months down the road has came back to you and said, hey, you were there when I was dealing with this, and
Oh,
I
yeah.
want to say thank you. Like, have you seen that happen?
Not that. They've said like you were there and like you took me here before and it helped and I think I need that again. But not necessarily like we don't hear a lot of like, I talked to you and thank you because you opened my eyes or thank you for your patience with me or thank you. We don't hear a lot of that.
I'm gonna go the opposite side because people have my phone number and they're often I get compliments on our officers at least once a week. And I'm lucky that I have 4 different departments, so there's a lot of people that we're touching and they're reaching back out to me, but I get lots of thank yous. I actually just got a call from somebody. Our officers responded to a suicidal individual, and they were able to get them to the hospital. And I just called to follow up just to make sure that the hospital offered resources, and if not, we have that to provide. And they were like, I've never had an interaction with a police officer in my life, and I never would have expected them to be so empathetic and compassionate to what I was going through. And now I'm not scared to ask for help. Like, she was like, when I heard that you were a social worker when you left me that voicemail, before that interaction, I probably would never called you back. But I want to tell you I am getting help now, and thank the officers that were there that night because they made a huge difference. So that, and I always make sure I send a text or call and say, I got a great compliment for you. So that way the officers do hear that, because she's right. They don't get a thank you. And we're helping people on their worst days. So thank you is not a word in your vocabulary typically when you're having a bad
Right.
day. So we definitely try to put that message back out there because, like I said, nobody's telling them thank you, but somebody might tell me that, and I try to make sure that they hear
Oh,
that.
that's good to hear.
Yeah, I do get it more often than I do. I usually just try to make it up, push the information out there, but clearly we can do better about sharing the thank yous.
So, I mean, everything we've been talking about is Oakland County specific. Is this, how's the state of Michigan? Like, do you know, are we pushing it out into other counties in the state? Or is there any kind of directive behind trying to get other, police to do this?
We've definitely we've definitely had other police departments in different counties reach out to our chiefs to just like what's up with this program and how do we get it started here. And we've definitely tried to give them the right information to get it started, because obviously we can only do within
Right.
our bounds here. But I think it's definitely noticeable, and I know that there are other counties that do co-response, but it might just look a little bit different than how we do it. But I will say that we're definitely catching attention of other communities that have reached out, because I've sat in on a few Zoom meetings with some chiefs from different police departments in Macomb County, things like that have been interested. So hopefully they'll pick up the ball and keep it going.
Yeah, hopefully it expands. Yeah.
So with that, without making this sound too detailed, how are you funded? Because this is such a great program, and it would be great to go statewide or even just right through the whole U.S. How do you get funded so that way people can help get more funding for that?
Yeah. So correct me if I'm wrong. I believe we started when it was just Hillary and just the first 3 communities. It was a grant. It was a grant that our justice manager had applied for and gotten, and that's how it started. All of our police departments, when they do sign on to this, they have to have a sustainability plan. So typically most of our communities are grant funded up front, and then once that runs out, then it is up to the police departments in their cities to then fund at least the salaries of their clinicians. But most of it is grants, and there's tons of grants out there that would support this. It's just finding it and putting in the work. Thank gosh we have an amazing manager that is great at writing grants and getting us some money, because without her we wouldn't have it. But it does fall on the police departments eventually to pick it up.
Okay, so with the police department side, would that fall under your millage or bonds?
It depends on whether you're a city, a township. It's, with taxes and all that complicated, lovely stuff. But yes, basically, when the grant runs out, it would be up to us to sustain the program. And with the results of the program that we've seen, it would be a very easy sell to our city administration to fund the program. And I think that I can speak to most of the communities, if not all, involved as far as that's concerned. We're very happy with the program. I think that pairing up with OCHN was absolutely the right move to do, and I think that's what makes our program so successful. I think that if we had just gone out and hired a social worker and been like, okay, you're going to calls with us and you're going to talk to people, them not knowing about the resources in the county would have been a huge missing piece. And some agencies have done that, and I think that that's better than doing nothing, definitely. But I think that the way we do it is vital to its success.
Yeah, for sure.
Mm-hmm.
And just to piggyback onto that, the beautiful thing about being an OCHN employee is that I have access to like our health records. So it's not just starting from scratch and asking this person to tell me everything they can about where they're at. If they're already connected to services, I can see that, and I can maybe just put an ear into the people that are already caring for them, so they know, hey, so-and-so is having a bad day, can you follow up? Or so-and-so is at the crisis center, so having OCHN as like our base is very helpful. And OCHN is like the community mental health for Oakland County. So we do provide the majority of mental health services, and we have tons of different providers. So it's nice to just be able to have connections into these individual providers as well as at the top here at OCHN to make sure people really are getting what they need. And if we didn't have that, I feel like our job would be very difficult. There is other outside resources in our community. We have lots of community help, but what OCHN has to offer is often what we can provide directly to people, and it usually works. So.
Mm-hmm. There's a lot of, I think, unintended benefits from the program that we've seen for our staff. Our staff, we experience trauma. We experience trauma ourselves and secondary trauma all the time. And sometimes we do debriefing sessions for our staff after an especially traumatic incident. And these guys have been absolutely instrumental in getting that going, because before it would just be like, oh, you had this rough scene today? Go home and have a drink. See you tomorrow, And it was like, it was not handled how it should have been. So now we are actually having debriefing sessions about these. We're talking about them as a group. If we have officers that need to be referred to other resources, we're doing that. And unfortunately, we've had officers that have had deaths in the family that they've helped us with, because they respond to that too. Sometimes we have death scenes where it's especially traumatic for the family, and they come out and help the family. So there's a lot of, this has a ripple effect to so many different things that we didn't even anticipate.
It's incredible.
And they bring ideas to the table too. Extra training for the officers. After CIT, this is a 40-hour program, and it's wonderful, but then there isn't really anything else after that. So they bring a lot of knowledge to the table as far as, let's do this training just in roll call every day, about such and such topic, so that we stay up to date and polished up on some of this stuff, or some of this new stuff.
It's like a match made in heaven.
It is.
It really is. I could sit here and talk about it all day, honestly.
I know.
I'm amazed by it. It's just
and
great.
it's way more than I even thought that it was.
Yeah, because when you first told me about it, I'm like, okay, so they do a ride along and they
That's what
talk to some people. Okay, so
they just jump in and ride along.
Yeah.
Yeah. So we were very naive.
A little bit.
That's good that we're here though. So that folks,
because I'm really hoping that our audience is taking note that this is an incredible thing that our police departments in Oakland County and hopefully others are doing to help those in crisis. And I'm so excited about it.
Yeah.
So excited about it. Because think about it. There's always been, kind of that police are mean and
there's always that, we don't want to deal with them.
So this kind of gives a different perspective.
Yeah. It is always like, it is a match made in heaven, because most, like we said, even our officers had to face that. It's like, oh, social work, like, oh, they think they're going to come in and save the world, and you can just hug everybody and they're going to feel better, and nobody needs to go to jail. And it's like, we actually realize we are on the same team and we all want the same things and we do have the same ethics. It's just, we have to learn how to work together to make sure we're actually providing a positive experience for people. And it's like, yeah, it is scary at first because it's like, oh, are we going to get along? Is it going to work? But it actually works together really well.
There are times when we're on a call and folks don't want to talk to us because they have, preconceived notions or a bad experience from before, which we understand. But before we were like, okay, well, I don't know what to do if you don't want to talk to me. I can't read your mind.
Yeah.
Whereas now, sometimes they are willing to talk to them, but not us, which is fine. I mean, it's great if they're there. It's awesome.
That's my favorite line. I'm like, I'm not a cop if it makes you feel any better. Yeah. And they're usually like, all right, yeah, I guess I can tell you what's going on.
Yeah, yeah.
That's awesome. So I know I'm just going to ask this because I don't know. I know you have canine dogs. Do you have therapy dogs?
Ooh.
Is that a thing?
Some of our departments do have. Maybe this is a nice plug to get one in Auburn Hills.
Oh, sorry,
Bloomfield Township, we have Maggie. She's awesome. We shared the wealth for sure. We just had our national night out at Auburn Hills, so they brought Maggie. So we did have a therapy and then a therapy dog, and the county actually has 13. Well, now 15. They just got 2 therapy dogs. So there's 13 little doggies.
Yeah, I saw sure just posted Chip and Maggie.
Yep.
I actually met one of them at the air show. They're so cute. Oh my God, it's adorable.
Yeah, they're awesome. They definitely pop around. And then in Birmingham, we have Maple. She's a Bernese Mountain Dog. She's a big baby. She's the sweetest thing ever. That's all we have at our departments right now. But
So do you take them, like, if you get a call from the police, do you take the therapy dogs, or is that, like, not really a...
I think that'd be a great idea. Typically their handlers are, both of our handlers are, like admin or our community resource officer. So they're not necessarily ready on the road for that. But if there is a bigger incident, unfortunately the splash pad in Rochester Hills, OCHN had a crisis family center that we popped up and were there just to let people talk. The prosecutor's office actually sent their therapy dog. So we had a therapy dog there while we were helping out the family and people that were affected by the splash pad tragedy. So we do try to use them as we can, but we don't typically take them on scenes with us.
I just wanted to ask because...
No, that's
a great idea, though.
I'm all about therapy dogs.
I keep saying we need a core dog. One of the sheriff's little doggies, OCHN does sponsor one of them, but I'm like, okay, so if we sponsor them, we should be able to bring them around a little bit, but haven't won that battle. It might be coming, yeah.
It is so funny. We had an officer in one of our CIT classes that had one, and we were doing a role play, and I was the person in crisis, and she's like, would having a little puppy in your lap make you feel better? And she just puts him in my lap, and I'm like, how could you not feel better with this little ball of love?
right.
That example right there should be the key checkpoint to it. Yeah, that's it.
Wow. Yeah, no, that's a really good point.
Yeah.
I like that.
Yeah, well, so many schools now are getting therapy dogs too for their students, if they're feeling a little, maybe not in crisis, but maybe just
Overwhelmed.
Yeah.
kind of a struggling place, that they're able to go and sit in a safe space and actually hang out with the therapy dogs now at schools. And I just think
It's awesome.
there's something to be said about, I mean, I know that there's also fears of dogs out there, but I think that for the most part, that's, I think, helped more than it's hurt.
I agree.
Absolutely.
So,
I agree.
well, what else are we missing? What else have we not asked you?
Website. Do you have a website?
Yes, it's just Oakland Community Health Network's website. It's like oaklandchn.org. If you put /justice, it gives all of our justice initiatives. Because like I said, CORE is just one of the many justice involved liaisons we have. But also OCHN has a wealth of programs and things. So the OCHN website's a great place to start. But if you want to know about CORE specifically, justice tab on there.
Okay.
Yep.
Perfect.
All right. Michelle, anything that we have not asked?
I don't think so.
I don't think so either.
Anything you want to share that,
I mean, like I said, I could talk about this all day.
I mean, it's awesome.
Yeah, I agree. But I think we've done a good job of covering the major stuff.
All right.
Yeah, I think
Cool.
so too.
Yeah, I just thought that this would be a great topic just to, put out there and make sure. Obviously, we didn't have a very good understanding of what it looked like. And so just putting it out there so that people know that, it is a resource and that police are good people. They're still safe people. So all right. Well, we really appreciate you
Yes.
coming on our show and talking about all of this. We really thank you for what both of you do
Yes.
for all of those out there who are struggling and in crisis and need a little extra love and help. So
We appreciate you too for
Yeah.
even just having this podcast. This is what we need to do. Talk about it. Get like it's okay to talk about. There is no stigma. We've all been touched by it. So let's just, it's okay.
that's right.
Mhm.
That's
Very
right.
true.
This just helps more people know that help's out there and help's
Yes.
okay to ask for. So that
You're
I'm
not
glad we're here.
alone.
No, you're not alone.
Absolutely. So it's okay to ask for help.
Mhm.
Yes.
All right. Anything else, Whitney?
I
You
think that's
good?
all. Yeah.
All right. Well, thank you again
Thank you.
for coming on. We appreciate it, and we'll
Catch you on the flip side.
This podcast is presented solely for educational and entertainment purposes. We are just your friends. Whitney and I are not licensed therapists, and this podcast is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional.